Today we're going to talk a little bit about thoracic mobility, thoracic extension, scapular mobility, and we have a little tool that was sent to us here, the thoracic manipulation tool, and we're going to try that out for some pistol grip thoracic extension PA mobilizations. Welcome back to Overhead Athletics. I'm Max Wardell. I'm joined by Austin Macias today. If we look at Austin just laying in prone, even with his arms up here, we see that he's got a pretty significant kyphosis in his mid-thoracic spine. So we're going to actually do some manipulations here on the thoracic spine. We're going to do some scapular mobilizations, and we're going to try to improve the way that the scapula sits and articulates on the rib cage by altering the dynamics and the kinematics of the mid and upper thoracic spine, as well as altering some of the tension profiles that are associated with how he moves his scapula. So I'm going to have him lay onto his back for me. We're going to start with some thoracic manipulation. So I have the TMT, thoracic manipulation tool, and there's a few different options, but kind of the one that I like is the one that sits in here, protects my phalanges. I'm going to have Austin cross across his chest, both arms. Scoot down just a little bit so we're away from this pillow. So I got him on the flat of the table. We'll start low, we'll work our way up. Roll him towards me, find the spinous processes, get my hand up and under there, roll him back, do a little sit up for me, a little mini crunch. Okay, relax. And I don't know if you could hear that, but it was pretty significant cavitation there. I get him all the way rolled over, so a lot of people like to do this manip from here and drive. All I have to do is roll him over, pin his arms down, and do a little drop. And we've had some good cavitations here. So roll, 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 roll. Got one. And what I'm going to have him do here is a nice little crunch of his neck. Crunch your neck, crunch up, 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 up. Deep breath. So on these upper ones, we got to do it a little bit better. One more. Okay, and then I'm going to have him roll over. So awesome little tool there for protecting my fingers, even on a meaty guy like Austin. We got some great cavitations. I hope you guys could hear it on video. I'm going to have you put your face down in the hole. This is going to go under your belly. So put this under your belly for me. Face in the hole. We're going to try to get the very top, and we might have got it already. Try one more time. I think feels pretty good. Deep breath. Yep, there it goes. So pretty mobile here. Now through his spine, now come back to where we were before in the beginning. Prone on your belly. We can actually see quite a bit better. Let's go hands behind the head. So hands up here. We can see a less pronounced thoracic kyphosis. Let's go and try to lift your head, elbows, everything up off the table. Pretty good, pretty good. Now let's look at his scapular mobility. So let's have you lay onto your side and face me. So we've kind of improved the dynamics of how he extends his spine a little bit. Let's look at his scapula. So we can kind of get up under there just a little bit. It's kind of tight. Come up towards me, towards the edge of the table. Definitely tight. And that probably doesn't feel too good for him. And I'm just peel, lift, little oscillatory traction lift of the scapula. Trying to use my finger pads as much as possible, not using my tips. And I can always do a functional massage from this position too, for whatever muscles that I feel are limiting my ability to peel his scapula off of his rib cage. And I'm just pulling laterally into upward rotation and protraction while I actually massage with both hands. So this hand's not only pulling the scapula, but it's massaging while this one's going more up into the superior part of the rhomboids, the distal insertion of the upper trapezius. And I'm not only grabbing it, I'm grabbing here with my hypothenar part of my hand. And then I'll come back and I'll drop him here. Internal rotation. And that's definitely tight. So here's what we're gonna do. This is gonna go on his anterior shoulder. Coracoid process. Let your hand fall back behind. Yep. Good. He is very, very tight. So if I want to do more upper trap, I'll just bring him into depression. Let him fall this way. Depression, depression. And I can downwardly rotate him too. So if I want, I can pin him there. Depress, depress, depress. And if you notice, he's got his arm under his head. I could have him have this pillow, which would probably be even better, more comfortable under his head. But really, now that we've kind of altered it, I'm just pulling him into a posterior tilt. Good. Okay, last thing, we're gonna do a little pec minor stretch on this side. And we would definitely repeat on both sides here with Austin. For the purpose of the video, I don't think it's necessary, but go onto your back. We're gonna come onto this side. Nice, easy pec minor stretch. This is gonna go, nice little towel roll. Roll for me. Is gonna go medial to the scapula. Relax. Medial to the scapula. This might be a little big. We'll see how it compresses. And there's a few ways that we can do this. I find that people generally tolerate it a little bit more if I pre-position them slightly into elevation. And I got my knee up here, which blocks him from coming into depression. Because depression is going to, once again, shorten pec minor. You feel a stretch? So there's a lot of ways we can do this. But I'm elevating him with my thigh. I'm pressing him back with my hand. Reposition that a little bit. Good. There it goes. And so I can bring him up to a little flexion to get a little bit more of a vantage point. And I'm just pushing posterior his old shoulder complex. So part of it, I'm going to have him push his shoulder towards the sky. So push up into my hands. Relax. There it goes. One more time. 1, 2, 3, 4, 5. Relax. Yep, right there. So here's your pec minor stretching. It's important to remember the pec minor doesn't attach to the humerus. It attaches to the coracoid process. So we have to move the scapula in the shoulder complex, not the glenohumeral joint. So let's just go back to your side one more time. Let's retest that. So I'm always test, retest. So when a guy meaty like him, you need some force. You definitely need some force. We're going to see what we can do. Oh yeah, definitely moves more freely into a posterior tilt. So here's your dynamic stretch for pec minor passively. And actually, just because we stretched it into a posterior tilt, I can get under the scapula quite a bit more. And then I could do my serratus length testing from here. I can do my subscap. So I have a lot of options because We've done a little massage, loosened up some of these structures, and then actually stretched pec minor. So to recap, often thoracic mobility limits our ability of the scapula to articulate properly with the rib cage. And if you see someone who's thoracic kyphosis dominant, sometimes the best thing to do is mobilize in the direction of fault. And so I don't know where my little thoracic tool went. There it is, my little thoracic tool here, TMT. You guys got to check them out if you're having a problem with your DIPs, your PIPs, your IPs, and give it a try, because I felt that it definitely protects my hand, but it also gives me a more stable foundation. Even if you grab a chapstick or something in your hand this way, I feel that it crushes my fingers, especially the DIPs, into the chapstick. So give it a try. Gives me a more rigid position. I definitely like it. So I don't get any money for telling you guys this. I just got one of the tools sent to me to try it out. So give that a try. But always make sure that if you're addressing some sort of limitation with how the scapula articulates with the rib cage, you got to address how the rib cage sits, which is dependent upon the position and the mobility of the thoracic spine, especially the upper thoracic spine. Make sure to subscribe, and we'll see you in the next video.